Today we have the nursing team at Hospital La Paz, and well, I want to say thank you to all of you for joining these interviews.
Hello there, nice to meet you all. We are all nurses and we work in this hospital, La Paz. They are going to talk now about a little bit about the work, okay?
But how has the hospital activity changed to adjust the pandemic?
Our hospital has converted 15 specialist hospitalization units into COVID units, reaching 1,200 beds for these patients. The hospital originally had 51 adult critical care beds. Initially, 10 of these beds were converted to care for patients affected by SARS-CoV-2. As cases increased, our hospital opened up to 150 beds for critical patients. Appointments for outpatient visits and non-urgent surgeries were cancelled. Health professionals from the services attended patients admitted to COVID-19 by that moment. Pedro, and what about pediatric activity? How has it been affected?
Well, one of the pediatric hospitalization units with capacity for 28 patients had to be transformed in 12 hours into a ward for adults patients due to an unstoppable demand for beds from the emergency department. On March 25, the hospital direction decided to transform the pediatric intensive care unit into an adult intensive care unit for patients affected by coronavirus, also adults and children. To carry out this transformation, the pediatric post-surgical resuscitation unit was transformed into a new pediatric ICU to accommodate properly the children who needed critical care and not affected by coronavirus. It took a huge amount of work in a short time to provide these units with the human and material resources necessary for this new healthcare function. It was also necessary to adjust the nursing workforce to new needs. Professionals from other units already trained in critical care joined this converted EQ immediately. I want to thank all these professionals who came to these new units voluntarily and making a huge effort to learn in a so short period of time. This new setup involved the reschedule of all personnel from the assigner and the receiving units. The attitude of most professionals have been excellent during all this time, despite the impact not only at a professional level, also personal, because many professionals have been living in hotels separate from their families.
Ines, tell me, which has been the decisions about the donation and transplant program at La Paz Hospital?
Adult transplant programs were stopped during the critical phase of the pandemic, although they are currently running again. This closure indirectly affects the pediatric living donor transplant programs. However, the pediatric transplant programs remain for critical cases. On 26, a heart transplant and a liver transplant were performed both from the same donor. On April 30, the surgeons performed a liver-kidney combined transplant. The Pediatric Hematology Service has successfully performed 3 Hematopoietic Stem Cell Transplant and infusion of teeth card cells since March 13. One of the donors' PCR was positive to COVID infection, and the bone marrow transplantation was made with a. Currently, all these children are in the pediatric transplantation ward or already at home, completing their recovery.
Eva, how has pediatric transplant been affected by these changes?
When the correspondent teams performed the heart and liver transplant, it had been 24 hours since the new pediatric intensive care unit had been set up in a different place and with a different nursing team. Because of that, it was necessary to reorganize the space with limited dirty and clean areas and their corresponding circuits to guarantee safety against the COVID-19. Not having confirmed cases at that time did not ensure that parents, professionals, and children could not be in the incubation phase. In addition to this, we reinforced training of all professionals in areas such as the correct use of masks, the putting on and taking off of personal protective equipment, handling of wasting clothing and equipment, and daily aspects. Those were the moments of more significant restrictions of the movement at the national level. Only one of the parents was allowed next to the child, and both were trapped in the hospital with no possibility of finding accommodation and without places to eat since all catering establishments were closed. Two solutions were found. On the one hand, HEPA, Patient Association for Liver Pediatric Transplantation, once again showed their solidarity and offered accommodation not only for the family of children with a liver transplantation, but also to the family of a girl waiting for a heart transplant. HEPA put in place measures to minimize the risks of transmission among the families staying in the flat. On the other hand, the supervisor of the child care area coordinated with hospitality assistance to offer parents of children admitted to this new pediatric intensive care unit snacks and drinks at lunch and dinner time. In the other areas of the children's hospital, a complete diet has been provided to all caregivers by the hospital kitchen service. Alba, in your opinion, what are the main issues you think may arise in the short term due to this situation in transplanted or waiting list children?
This situation has highlighted the importance of infection and their proper management to avoid transmission. It would be desirable for us to maintain strict compliance with some of the isolation and protective measures. The appropriate handling of mask and hand hygiene, the rules of social distance applied to the transmission of multi-resistant pathogens, great rigor in the hygienic sanitary measures that professionals must comply with, few objects in the room to ensure proper cleaning, and restriction of patient movements within the hospital. Pancho, in your opinion, are there special measures from transplanted children and their families to put in place now that the healthcare activity has begun?
The application of the measures established by the Preventive Medicine Service for all patients from now on aim at minimizing the risk of spreading the virus from possible asymptomatic carriers. Health professionals have to assess the feasibility of the implication of these measures at short and medium term. The hospitalization time of some of the children during the transplant process is lengthy. The isolation of the family within the room without visits and minimizing the exchange of caregivers carries emotional and affective consequences that must be taken into account. Psychological support throughout this process is essential to anticipate the risk and minimize the effects. The isolation of each family within the room without visits and reducing the exchange of caregivers complicates the family adjustment to take care of the child even more. Example, work, other children, etc. Even though this aspect is not new, the assessment and monitoring of family social economic situation are even more critical now. Immunosuppressed children should not share common spaces with other children in the emergency waiting rooms and consultations. The current distribution of the areas does not allow offering this separation. Isolation has also brought about the disappearance of humanization support structures such as game rooms, volunteers, leisure activities, etc. However, the hardening of the isolation makes them more necessary now. We have to find creative solutions to this problem to keep children connected with their childhood. Education, physical activities, play, and socialization are essential for the proper biopsychosocial development of children and adolescents. It is also essential to reinforce health education from the nurse to the children and caregivers in aspects related to infection prevention, to minimize fear and provide safety, but avoiding overprotection and measures that do not offer real health benefits to the patient and their families. Promote the use of digital tools that allow us to maintain contact and guarantee the continuity of care when unforeseen events arise. Redraw up the skill support of these children during admission to guarantee continuity. In addition, we know many other needs will appear these next months because of the safety solutions. We hope to be able to give an appropriate solution to all of them.